Namaste. Today we'll talk about a difficult kidney disease called nephrotic syndrome. This disease is a chronic and recurrent disease observed more in children and also in adults many times. This is a disease which is considered as autoimmune disease, but in reality we don't understand this disease so very well because we don't know the exact cause behind this disease. In this disease, one observes that there is abnormal leakage of proteins due to some malfunction in the kidneys. The nephrons, the basic unit of the kidney, is not functioning properly. It is not doing the filtration adequately, and as a result, as an abnormal process, it is leaking protein. So the protein is coming out of the body out of proportion, and in the body there is less protein, what is called as hypoproteinemia, in which body has less protein, less albumin. As a result, some of the symptoms such as swelling of the body, fluid retention, and subsequently patient may also develop high blood pressure, high cholesterol. Because it is an autoimmune disease and it is chronic inflammatory disease, immunosuppressant medicines such as corticosteroids or cyclosporine or cyclophosphamide, they help the patient. However, this treatment is not most ideal because none of these medicines mentioned will really cure nephrotic syndrome. It can definitely help very well to meet with the current crisis of acute episode of nephrotic syndrome, whereby it dramatically brings the recovery from acute leakage of the protein, and as a result the patient stops having swelling and passing of abnormal protein in the urine. However, the treatment is not the most ideal because the medicines will produce so many adverse effects, and not only that, it also produces dependency. At one time, it may also so happen that after taking corticosteroids for a long time, there may be resistance. The body may resist to work and cortisol may stop working in the body. So then you may require another higher level of immunosuppressive medicines like cyclophosphamide or cyclosporine, which has its own more severe adverse effects. Then what is the solution? Does homeopathy have cure for this? Can homeopathy really help in the cases of nephrotic syndrome? Can homeopathy give a substitute to immunosuppressant medicines like corticosteroids, etc.? I would like to share some thoughts based on having treated over 950 cases of nephrotic syndrome in last 40 years as per our database. We have learned a lot of things. We have learned that homeopathy helps cases of nephrotic syndrome for sure. We have also learned that homeopathy alone may not help every case of nephrotic syndrome. We also noted that homeopathy may fail many times in the cases of nephrotic syndrome. And it is not very uncommon because there are so many difficult diseases in which many medicines may work initially and may not work also. So this is a common experience in the treatment of any chronic, difficult, obstinate disease. Same is the case with nephrotic syndrome. But I am sharing with you certain honest observations based on significant experience in the treatment of nephrotic syndrome. What is the role of homeopathy for nephrotic syndrome? If you ask me, I would say that homeopathy has a role to play which can help you to reduce the episodes of nephrotic syndrome. It can help you reduce the episodes of protein leakage, proteinuria, and reducing the swelling episodes. It can also help you reduce the drug dependency on corticosteroids. It can help you reduce the duration of every episode of the leakage. And also it can help you meet with some of the adverse effects of corticosteroids. However, that is not our major focus. Should homeopathy and allopathy medicines be taken together in the cases of nephrotic syndrome? The answer is yes. Because every acute crisis of nephrotic syndrome, which may be the nephrotic syndrome or what is also called as IgA nephropathy or minimal change nephropathy, all these are related conditions. All the cases may not be helped significantly with homeopathy alone. That has been our experience. At the same time, both the medicines will be required and there should be judicial use of integration of homeopathy and allopathy together to meet with this difficult disease. And for that, parents of children having this disease or the patients themselves having this disease and the conventional practitioners, nephrologists and other physicians who are treating you for this disease, they all should know, I would say they all must know about homeopathy as an alternative supportive therapy to meet with this difficulty. So a very strategic integration of both the systems of medicine and of course certain dietary changes will help control this disease and take the disease into remission, a disease-free period over a long time. I hope this experience-based information will help the patients having nephrotic syndrome as well as the parents whose children might be suffering with this problem and the struggle that you may be having in handling this disease. Thank you so much.